Hi, my name is Redman. I'll be speaking on behalf of combating the prevalence of sexually transmitted diseases among college students. The prevalence of sexually transmitted diseases on college campuses is extremely high. Some of the factors causing college kids to be more at risk compared to the rest of the population include numerous: sexual partners, the casual hookup, the one-night stands, and alcohol. Lubbock, Texas has a much higher rate than the rest of the nation with STDs because there's really nothing to do and a lot of people get chlamydia. This includes both people of Lubbock and the students of Texas Tech. The goal of this article is to explore how a public relations effort to help educate college students and raise awareness of STDs and prevent them. STDs are infections caused by sexual contact. They are passed from one person to another through different forms: skin to skin, vaginal, anal, or oral sex. There are over 20 different types of STDs, but the main ones are chlamydia, genital herpes, gonorrhea, HIV and AIDS, HPV, syphilis, and so forth. STDs affect both men and women, but can be more threatening for women, especially when they are pregnated. According to Silver, 2016, the causes of STDs include multiple sexual partners, failure to use condoms, and lack of perceived vulnerability in sexual self-efficacy. Addressing these causes may help stop the surge of STDs. College students and young adults contract sexually transmitted diseases at a much higher rate than any other age group. According to CDC, people ages 15 to 24 account for half of all STDs that occur in the U.S. Even though STDs have been the same for almost all of history, there's an increased rate of STDs in college students now than ever before. Millennials. The media glorifies sex and behaviors that lead to sexual activity such as drugs and alcohol. Also, there's a shift in attitude throughout young adults as they have taken a more casual view of sexual contact. People feel more casual about having sex than ever before, contributing to an increased frequency of sexual contact and increased numbers of sexual partners. Many young adults, especially men, are praised for the amount of sexual partners they can get with, without regard for need for a relationship with each other. They just get after it. The prevalence of STDs is very alarming in Lubbock, most likely because of students at Texas Tech. A very infamous term used for the STD problem in Lubbock is referred to as the Raider Rash. It comes from the mascot of Texas Tech, Raider Red, and the high rate of STDs in Lubbock according to the Lubbock Online. Meanwhile, the city ranks 8th in Texas, and the country ranks 11th out of 254 Texas counties for STDs. It is hard to know exactly what the problem is and how it stems from in the population of college students to the people of Lubbock itself. If the students of Tech would be exposed to a public relations campaign that focused more on the messages that students received, and including STD prevention, treatment, and prevalence, and taking glamour away from sex and other activities that lead to it, would the rate of STDs decrease. The campaign will focus on chlamydia, since Lubbock's rate is 3 to 4 times higher than the rest of the nation. Wow. So here, the goal is to lower the rate of chlamydia in Lubbock. Our objectives would be, for one, to have an effect on awareness of college students about the prevalence of chlamydia in Lubbock. 2, to have an effect on action, specifically getting college students to make smarter decisions about having protected sex and their sexual partners. 3, to have an effect on awareness of the message the community is promoting to college students and the glorification of sex, and for college students to be more aware of what they see in the media. And lastly, to have an effect on action that college students will begin to understand how society and the media are impacting them and to make the proper adjustments to fix that. We're trying to target the students at Texas Tech, and we're going to have to use medical personnel from the Students Wellness Center to help create messages and speak to the students about the dangers of STDs. help the students be more aware of the options they have to engage in safe sex and how to acquire those. Increase the media messages about the factors leading to STDs and how they can make the right decision for themselves. The message strategies will have to be, the doctors will discuss how people could get chlamydia, how it's treated, and how to protect yourself from it. You need to create publicity by putting up posters and using the Texas Tech student newspaper and print articles on these topics. You need to run commercial ads throughout the different buildings and TVs about the glorification of sex and raise awareness of the importance to get tested. Tactics. At every freshman orientation, the medical personnel from the Student Wellness Center will engage in a discussion with students, not their parents, about chlamydia and its prevalence here at Tech. And the sub put up posters promoting safe sex and visiting the Student Wellness Center for any questions for help. Also, we should have the daily Tirade or print articles about the psychology behind society's viewpoints on sex and how to be aware of the messages you are taking in. Evaluation. In 1 year, we'll evaluate chlamydia in Lubbock and see if it's declined. Have the freshmen fill out a survey after the talk about how effective the message was to them. The literature review. This problem will require an interdisciplinary approach because of the scope of the problem and how it needs to be addressed. According to a man, 3 factors that contribute to an increased chance of contracting chlamydia are race, number of sexual partners, and the use of barrier methods. Found that the number of sexual partners increases, so does the rate of incidences of chlamydia. One thing that can affect this high rate is the use of contraception barrier methods, which can decrease the rate if they are used correctly. The CDC says that if you do show symptoms, they will most likely appear as abnormal discharge, burning sensation while urinating, and pain or swelling in the area. If untreated, chlamydia can cause serious problems to a person's reproductive system. This happens more often in women than men, and untreated chlamydia can also lead to infertilization in both men and women. Psychologists understand why we do the things we do. They will have a better explanation for behavior of college students and factors that go into the increased sexual activity in college students. Not getting tested can lead to serious health problems, but can also cause people to spread it as they were not getting the right treatment to get rid of it, or they do not know that they have it. It's important to point out all that's in order to fix this problem. Society must work to fix the social stigma of STDs and getting tested for them. They need to make sure they do not pass along any unintentional judgments which could decrease a student's likelihood of going back. Another factor in affecting the rate in college students is alcohol. A lot of alcohol is drank on the campus of Texas Tech, and it's a big problem. In a study done by Brown and Venable, unprotected vaginal sex was reported by 39% of the sample, and 32% reported alcohol use to prior sex. When engaging in unprotected sex, the partners are putting both of themselves at risk for STDs. Also, alcohol consumption with unsteady partners can put you at risk an increased amount of sexual partners, and you do not know who the sexual activity and contraception, which could affect the rates of STDs. Lastly, one of the biggest problems on college campuses is what they call casual hookup. The casual hookup culture relates to any sexual encounter between 2 partners that are not in a relationship with each other and are not aspiring to be either. This casual hookup culture allows college students to have multiple sexual partners and to not be in a relationship. Lastly, another field that will be very important to answer this question is the field of media and communication, but more specifically, public relations. They know the best way to reach a big audience and how to shape your message is to target specific audiences. Integrating all 3 of these disciplines, maybe another, will create a better, more effective approach to this problem. There's not a lot of research done about campaigns for STD prevention among college students. But to conclude all of this, college students are at a much greater risk for STDs than any other age group. To combat this issue, a team of interdisciplinarians needs to work together. This would require public relations personnel to lead them with medical personnel and psychologists. This will ensure the right amount of information and gets put out in the best way possible. If any one of these disciplines tried to do it on their own, they would not be successful. The doctors knows the information about STDs, but does not know how to put the information out. The same goes with psychologists, and how they know all the factors related to how college students put themselves in these situations. Yet, they need actual information about STDs and the public relations personnel to set it all up. One key aspect to this campaign is addressing all angles of the situation, including the who, what, where, when, why, and how. College students will learn about chlamydia, but they will also learn about what puts the situations that put them at higher risk of contraception. They will learn how to be safer, smarter, and healthier by making smarter decisions about condom use and sexual partners. Thank you.